Okay, welcome back to backtalkonair.com. I'm Dr. Ed Kornel, your host, a practicing neurosurgeon here in New York in Westchester County. We service the entire New York metropolitan area here with our sidekick and producer, Bobby, Mr. No Wrench Knight. That's because we needed a wrench today, and he didn't have one. He didn't even have any duct tape.
But I did have clear tape.
But Michael Noah Manfleisch worked it out. So the final segment today, Monday, August 13th of 2012, we're going to talk about some interesting neurosurgical cases of this past couple of weeks. First of all, people always ask about what's an inoperable brain tumor. Well, the majority of brain tumors are actually at least partially operable. Unfortunately, when we come across tumors that are intrinsic to the brain, generally they are gliomas, we cannot, it's a type of tumor that arises from the brain cells themselves, we cannot resect it fully the majority of the time because it has tentacle type cells that reach out into further reaches of the brain. And studies have shown that even when we've thought that we have resected the entire tumor, there may well be tumor cells left peripherally. However, there are tumors that are located in areas of the brain that are so deep that we really can't resect any of them. And this is one sad case of a woman in her late 30s who presented with about a month of progressive weakness of the right side of her body. It was really a very rapid change in her ability to function normally. And so it portends for an aggressive type of illness. The MRI showed that there was a lesion, a tumor, deep within the brain. And you can see here, these images, the white is the tumor. And it is deep within the brain, in an area called the thalamus, going into the midbrain. So this is not a tumor that is resectable because it is in areas of the brain that if we tried to remove it, would lead to profound neurologic deficits, and we wouldn't be curing it anyway. So the most that we can do in a situation like this is biopsy it with a needle to get tissue to determine what type of tumor it is, to then be able to best treat it, whether with radiation, whether with chemotherapy, whether with vaccines that we are now in clinical trials with. But this is one of those sad cases where we really can't offer much from a surgical point of view. We did talk about an interesting case where we are able to provide great benefit. A couple of weeks ago, we talked about a colloid cyst. Well, a colloid cyst is a benign tumor that occurs deep within the brain in the ventricular system. The ventricular system is the part of the brain deep within the brain that contains spinal fluid. As we've mentioned before, the brain makes a half a liter of spinal fluid a day in the ventricles, which has to then travel through the ventricles out to the surface of the brain after going down through the spine, comes back up and gets absorbed on the surface of the brain. If there's an obstruction to the flow of spinal fluid, then it builds up quickly and you get increases in pressure in the brain and altered function. So here is a beautiful rendering of a slice of the brain. Here's the front, back of the head. These are the fluid cavities, the lateral ventricles, and they connect to the third ventricle through these little passageways called the foramen of Monro. So if there's an obstruction right here, you don't get drainage of the lateral ventricles into the third ventricle, and you get these ventricles, the lateral ventricles, to expand and blow up, so to speak. This particular gentleman had a problem with memory and with personality changes and with bladder control. All of these occur as frontal lobe function is disrupted. So this gentleman was actually quite aggressive initially. He was angry, and he'd been progressively more angry for over a year. Well, finally, CAT scan and then MRI was obtained, which showed this colloid cyst that was causing hydrocephalus. So the way that we approach this is surgically we go in to the expanded ventricle, go down to the site where the colloid cyst resides, and remove that colloid cyst, opening up the passageways again. And here is a picture. We're looking now through the microscope, through the ventricle. We're in the ventricle, in the lateral ventricle, looking into the foramen of Monroe. And here you can see this is the tumor, and we're about to extract that tumor from within that opening. It's an important area around there because the fornix is in that area, and the fornix is very important in memory. You can see now in this picture, which is even more magnified, we now have the opening with the tumor out. So now spinal fluid can flow from the lateral ventricles into the third ventricle. So that was, as I promised last time, images of the actual colloid cyst and removal of the colloid cyst.
So in this case here, where the woman has the tumor deep
The unresectable one?
Right. So what are you able to do for her since you're unable to help her surgically? Can that be cured with radiation and chemo?
Well, it really depends on what type of tumor it is, but because of the